Earlier this week, Diane had an interesting chat with Dr. Arnold Waine.
On today's show, we have with us Dr. Arnold Waine, a surgeon at the Port Moresby General Hospital, as well as a senior lecturer at the Medical School of the University of Papua New Guinea. Welcome, Dr. Waine, and thanks for being with us.
Thank you, Diane. Thank you for having me here. Excellent.
So on the last show, you spoke about the major forms of cancer, and you mentioned a bit about breast cancer, but more focused on cervical cancer. So can you talk with us today about breast cancer and maybe start off with the symptoms associated with breast cancer and why you think it's become on a prevalence in PNG.
Thanks, Diane. I think to compare to the cervical and the breast cancer, I do a lot more on breast cancer than the cervical, because the cervical cancers, anything to do with ladies, they're done by the gynecologist, and I'm not a gynecologist. Anyhow, so in the breast issue, we're seeing a lot of these ladies with breast as young as 19 and 20 years old, and I've treated over the last 5 years. I've seen about almost 10 young, very young. I'm talking about very young, like 18 and 19 years old, with breast cancers. The recent one I had was 2 years ago from Rigo. One lady from Rigo was an 18-year-old girl, came with a massive, very large breast, and as usual. It's a classical case for Papua New Guinean where they thought it's more sorcery, more porcine, and all these things. So they kept them at home and they used leaves, some traditional herbs and stuff like that, until this one was really, really huge. So they have to bring her into the hospital. So this is a classical case, and when I look at her, I'll look at the bigger picture of Papua New Guineans, how ladies go through. The reasons why I say this is because the cancer care, especially for the ladies with breast cancers, is quite difficult, very difficult to get through the care and the treatment protocols in any hospital in Papua New Guinea. I work in the big tertiary hospital where all Papua New Guineans, when they're sick, the last resort is Port Moresby General Hospital. So I work there, and I realized that cancer treatment and care about cancer with ladies with breast cancer is quite difficult and strenuous. To start with, the symptoms, it doesn't happen like, I suddenly wake up the next day and you see an ulcer on the breast. It doesn't happen like this. It may be a lump, and it may be very, very small. They call them insidious, very small, and hardly they feel, hardly they notice. And then suddenly it becomes a big one, and they feel that every time when they move around or they're in the shower, they feel there's a lump. That's the first thing. That's the first thing probably they feel. At other times, they may probably squeeze and they see through a nipple, they see blood discharging. Not milk, but blood discharging, and that's when they're also thinking that something must be happening. There might be a sore or so. The other times that they feel, as I said, they feel a lump in the armpit, not on the breast, but on the armpit, and they what they call a lymph node. And then they realize that no, there might be flu or there might be something happening. So those are a few things that they do. Our ladies often come to the hospital. So it may be an ulcer, it may be a lump, or it may be a discharge, as in blood through the nipple. So these are a few and commonest presentation at any clinic in our hospital in the country. So these are symptoms, and by the time people realize, example for a lump, it goes from a very tiny 1/5 size, then to a 20 size or 50 coin size. Then it's a big one. It's more than 2 centimeter diameter. So they're going from stage 1 to stage 2 now. We only go to stage 4 for this kind of assessment. By the time we go to stage 4, it's out of the breast. It's in the bone or in the lungs or somewhere. So it's quite frightening, in the time when they come to the hospital and when we put a diagnosis to it. So to start with, it's very difficult to understand. So oftentimes we get patients coming into the hospital in stage 2 or stage 3. And then the treatment are different, ways of doing it. If you come in stage 1, yes, the treatment is different. Stage 2, different treatments. So oftentimes they come to stage 2 and stage 3. Stage 4, no, we can't do much. You probably go back home, stay with your family, and your last maybe less than 5 years old, 5 years.
So how can you check to see if you have breast cancer?
We advocate primarily that not all the time doctors and nurses are there in the house. House is where, in your homes is where you have your shower, you have all the things. So we encourage all our ladies to have their own examination while they're in shower. So they feel for lumps, they feel for blood discharge, they feel for anything that is funny, maybe a small sore on the breast. These are things we advise them to do. They do a self-breast examination at home when they're in a shower. Then, if they feel anything funny, they come to the hospital to get checked by a nurse or a doctor. And then we ask them to do a scan, which is basically an ultrasound scan, but more ideally to do a mammogram, which is an x-ray of the breast. And those three will constitute your examination of the complete breast.
So when you say self-examination, is that running their hands over their breast in the shower to see if there's any lumps?
Definitely. So we advocate for ladies to do it themselves in the shower. Feel the lump and squeeze the breast for blood discharge in the nipple. And feel anything that is funny, that's all.
Great. Well, we only have a few minutes left on the show. Can you just stress some key points about breast cancer to our viewers?
Definitely for breast cancer in this country is very poor in terms of treatment. I work from the hospital point of view. There's no proper treatment, and treatment is taking forever. So my advice is come and be checked. Check yourself at home, come and be checked by a nurse or a doctor as early as possible. That's the message out there to the public.
Great. Well, thank you so much for being with us on the show today.
Thank you, Diane. I'm always happy looking for the next one.
Thank you, Dr. Waine, for that life-saving information, especially in regards to cancer. Dr. Waine will be back next week with another interesting health topic. Coming up after the break, what's hitting the trending world?